As we move further into this latest surge of COVID cases, hospitals across the country and right here in Ohio are once again seeing an increase in patients. But what is the situation like inside of those hospitals? We're joined this evening by Dr. Karl Fernandes. Dr. Fernandes is an adult pulmonary and critical care physician for Toledo Clinic and a partner of the VProject. Dr. Fernandes, thanks so much for joining us. You've had a busy few weeks responding to these patients who need expert care. What can you tell us about what you've been seeing in the hospitals, the general age of people, their health condition before they come in with COVID?
Thank you for having me on today. So in July 4th in Ohio, we had 0 cases, new cases. I'm sorry, in Lucas County, we had 0 new cases. Now we have about 47 as of yesterday. So these are probably driven mainly by the Delta variant. The ages, we're seeing a lot younger people this time around, between the ages of 40 and 60, and they're all predominantly unvaccinated. If they are vaccinated, they're immunocompromised in some way. Their immune system isn't working as well. But the majority are, and definitely in the intensive care unit, are all unvaccinated patients. And unfortunately, by the time you get into the intensive care unit, your chances of having serious complications are very, very high.
Yeah, we saw a big jump with people who are in ICU and on ventilators just in the last couple of days. What about the staff there? I talked to some nurses a few weeks ago who seemed very overwhelmed. They are taxed out. They've got tons of patients. What kind of a mental toll has this past year had on you and your colleagues?
It's had a huge emotional toll on healthcare workers in general. Many have quit and gone into other fields. The people who could have worked another 5 years or so have said they've had enough. Currently, people they just can't understand why they're not getting, other people are not getting vaccinated, because that's, our prevention. Look, the vaccine's not 100%, but what it'll do is around 90 to 95% of the time, you will not have a serious illness. And the transmission rates of the virus are much lower in those who are vaccinated than not vaccinated. The nurses are working their hearts out. They're short-staffed because of the crisis in all the hospitals, I think, in Toledo. And so it's been very difficult. Respiratory therapists and, of course, physicians, the frontline physicians that we work day in and day out. It does take a toll. It takes a toll on family life as well.
And as a doctor, what are you hearing from patients and people who don't want to get the vaccine? What is their issue with the vaccine and getting vaccinated?
Well, there are many myths that are unfortunately spread on the internet, and you can't combat all of them. You just have to refer them to the proper sources. A lot of it is fear of the unknown and fear of side effects. But of course, the side effect of COVID, the main side effect is death. And there's, patients have long complications, even if they're not hospitalized, if they get COVID. And that's what I try to tell my patients. The VProject has a great site, VProject.org, that has a lot of information, a lot of myth-busting information. These vaccines work. We know that. There's been data from the original studies, and also now we've had over 6 to 7 months of people actually getting vaccinated, and it really shows that it works. And I ask my fellow physicians, please tell your patients directly to get vaccinated to prevent them coming into the intensive care unit.
Dr. Fernandes from the VProject, we've heard the CDC recommending that as well, that doctors check in with their patients and ask that they get vaccinated. Thanks so much for your time tonight and with the VProject.
Thank you for having me.